esteemed members of this hearing, thank you for your invitation to be here this morning. I am here on behalf of the Irish Catholic Bishops' Conference. I am joined by Father Timothy Bartlett from the Secretariat of the Conference. As an advisor on this matter, he will be happy to answer questions. We welcome this opportunity to engage with members of the committee. We welcome the calm and dignified way in which the discussions have been by the committee over recent days. With you and with others, we want to develop a society that is truly worthy of the dignity of every person. A society equally cherished and respected. As public representatives, you carry a heavy responsibility. In making this presentation to you this morning, I am thinking in particular of the many women in our parishes across the country who are deeply concerned about the decision to legislate for abortion. We hope you will take account of these concerns in your decisions over the coming weeks and months. We share your concern to ensure that any young girl or woman who finds herself in crisis pregnancy receives all the love, all the care and the support she needs to cope with that situation in a life-giving way. CURA, the Crisis Pregnancy Agency of the Catholic Church in Ireland, is dedicated to providing compassionate and expert support to any woman who finds herself in this situation. Compassion, understanding, respect. These should be central to any discussion about responding to a situation of crisis or difficult pregnancy. As a church, we also want to see mothers and their unborn children receive all the medical care and life-saving treatment they need during pregnancy. There is nothing in current Irish law, in current medical guidelines, or in Catholic ethics that prevents such treatment from being given. The doctors, nurses and midwives in our hospitals show an extraordinary concern for the life and well-being of mothers and their unborn children during pregnancy. These medical professionals deserve our deepest appreciation and respect. In Ireland, we have one of the lowest rates of maternal mortality in the world during pregnancy. This is something we should be proud of as a nation. It is something we should do all in our power to cherish and protect. Any suggestion that Ireland is an unsafe place for pregnant mothers because we do not have abortion is a complete distortion of the truth. It is also gravely unjust to the doctors, nurses and midwives in our hospitals who have achieved such internationally celebrated standards of maternity care. We believe that these high standards of maternity care have been influenced in no small part by the recognition in Article 43.3 of Monarch na Herd that a mother and an unborn child have an equal right to life. This coincides with our belief as a church, based on human reason and affirmed by sacred scripture, that the life of a mother and her unborn baby are both sacred. The Catholic Church has never taught that the life of the child in the womb should be preferred to that of the mother, or the life of the mother to that of the child. Moreover, there is clearly considerable confusion about the terminology being used in the discussion about medical intervention to save the life of a mother. The Catholic Church recognises a vital moral distinction between medical intervention to save the life of the mother and abortion. Abortion, understood as the direct and intentional killing of an unborn child in the womb, is never morally permissible. This is because directly and intentionally taking the life of any innocent person is never morally acceptable. This is different from medical treatment to save the life of the mother, where there is no other option and where the intervention does not directly and intentionally seek to end the life of the unborn baby. Every effort is made in this situation to preserve the life of both mother and baby throughout. This position, which is ethically sound, represents best practice in Irish hospitals today. However, legislating for the X case removes the obligation to make every effort at all times to preserve the life of both mother and unborn baby. It allows for abortion, for the direct and intentional killing of the baby in the womb. It is not necessary to legislate for the X case to ensure that women in Ireland receive all the life-saving treatment they need during pregnancy. It is not necessary to satisfy the European Court of Human Rights. There is another way. Other options are available to the government that do not involve legislating for abortion. These include the option of appropriate guidelines which continue to exclude the direct and intentional killing of the unborn, or a referendum to overcome the X case judgment. We believe both of these options should be fully explored by the Oireachtas. As a Bishops' Conference, we have always held, with many others, that the judgment of the Supreme Court in the X case is not a basis on which to move forward on this critical issue. In that judgment, the Court unilaterally overturned the pro-life intention and the will of the people in 1983 referendum. It heard no psychiatric evidence. It believed that abortion was an answer to suicidal ideation, whereas current research indicates that suicidal ideation rarely relates to a single cause, and that abortion itself can lead to suicidal ideation and mental health difficulties. The position it took is also morally unacceptable. You cannot morally equate the possible but preventable death of one person with the deliberate and the intentional destruction of the life of a different, though innocent person, a totally innocent person. How would you or I respond to someone who is suicidal in any other situation? Surely our concern would be to ensure that they receive all the personal, professional and medical support they need. Surely it would be to protect them from harming themselves and to help them to come to a long-term, life-affirming approach to their difficult situation. It is our view that giving sufficient professional support and care should be the priority in response to suicidal ideation in pregnancy. Taking the life of another innocent person with absolutely no guarantee that it will remove suicidal thoughts and the real possibility that it may make the situation worse can never be regarded as a humane or morally appropriate response.
That's fine. Just say that. If you want, you can finish the paragraph here. Go ahead.
Can I? Yeah. Finally, the X case judgment potentially permits abortion up to birth. In addition, assurances that legislation will limit abortion to very specific circumstances are unreliable. Any such limitations will inevitably become subject to challenge in the courts. No matter what way legislation is approached, the moral and legislative difficulties posed by the X case judgment can only be addressed definitively by a return to the people in a referendum. In the meantime, we should be mindful of our excellent system of care for women and unborn children in our hospitals. Thank you.
Thank you very much, Dr. Jones.
What do we intend, when we ask for a referendum to reverse the Supreme Court judgment in the X case? We just believe that Supreme Court judgment reversed totally the will of the Irish people. 76% of our people voted for Article 43.3 in the Constitution. And our wish would be, as one option, that a referendum would be give the people a chance to re-establish what they originally wished for and intended. And we were very surprised, indeed shocked, that the Supreme Court judgment on the X case.
The microphone, sorry Dr. Jones, thank you.
Sorry.
Thank you.
Do I go back to
No.
No, that's where we're coming from. We were very much upset, really, and surprised by the ruling of the Supreme Court judgment. We feel it was unsound. We feel also that there was no psychiatrist available, an expert in that field, especially with teenagers, to give advice on the whole issue of suicide and mental health. And for that reason, we feel any legislation that will be based or introduced in the light of that unsound judgment would not be sound. So therefore, that's one of our options. Is to our first option, I think, would be to have the medical guidelines enhanced, so that doctors and nurses have no fear whatever in providing every single possible treatment there is available to for the help of the mother whose life is at risk. We would welcome that. But what we regret very much, if we go down the road of legislation, it's inevitably the road to abortion. And that will change our whole two-patient model. The life of the mother and the life of the unborn child will be no longer equal, because we'll be giving the right to someone in certain situations to literally take the life of the unborn. And that we can't do. We believe totally in the equal right of mother and child. And I might answer in response to one of the statements made, I might add, we don't depend on religious reasons or scriptural reasons for that. We believe that each, the mother and the unborn child, have equal rights in virtue of their common humanity, which is accessible to human reason. Of course, the gospel, we believe, enhances the whole dignity of the human person and our understanding of human life. But we don't depend on that, and we would never want to impose our understanding from the gospel on any other religious group or on any atheist.
Dr. Bartlett, would you make any comment?
Yes, first of all, Chair, just to thank you for your warm welcome. It strikes me as I listen to the various contributions this morning, and we work together very closely as churches and as faith communities, and Michael and I have debated very honestly and openly in public fora about faith and the challenges to faith and so on. But the thread that has been running through all of our contributions, and I think unites everybody in this room this morning, is our shared desire for a compassionate, caring, humane and just society. And I think it's always worth coming back to that. What's at issue is how that can be best achieved in legislation in this particular complex and sensitive area in medical practice as well. And as Bishop Jones has pointed out, I think we have to keep coming back to the fact that life-saving treatment for women in pregnancy is available at the moment. And the Catholic ethical position has no opposition to that. However, just to come back then to the specific questions and maybe to supplement some of the responses that Bishop Jones has given. The issue of the two previous referenda to overturn the case or the inclusion of suicide, your predecessors in the Oireachtas Committee, all-party committee in 2000, who looked at the 1992 referendum in light of X and what to do in response to X, they acknowledged that that 1992 referendum was incredibly confused and that people on both sides of the argument voted to defeat the referendum. So it wasn't a clear, to use the shorthand, pro-choice, pro-life result. And similarly, as we all know, I'm sure it's an easier one, the 2002 referendum, the margin was extremely tight, the defeat of it, but there was evidence that large numbers of pro-life people voted to defeat it as well. But beyond all of that, could I suggest that there is a reason why we hold our judges and courts, and particularly the Supreme Court, in the highest of esteem, and we treat seriously, very gravely, any judgment that they give. However, that we don't have judges and lawyers running the country, or indeed framing legislation. That is your responsibility, a responsibility that as churches we respect and seek to assist in terms of, as you've invited us to do, offering our views. But in that regard, you are free as legislators to consider the wider issues. The Supreme Court looked only at the legal issue and evaluated the situation in terms of law. As Bishop Jones pointed out in his opening presentation, there are psychiatric developments that need to be now taken into account. There's moral issues, the inability to equate, the possible but not certain and preventable death of someone in suicide as opposed to the certain death of a child. And our response to that is, in the 21st century, what reflects a compassionate, humane and intelligent society? Is it not that we provide the best possible care and support to make someone, help someone to make a life-affirming decision? And just finally, for the record, in response to Deputy Conway, no one from the Catholic Church has ever said, in any official role or responsibility or in any statement, that we believe women will somehow tried to mislead. We have never, ever said that. The jeopardy arises from the experience in other jurisdictions of trying to legislate in this area, the vexed nature and the real danger of unintended, sincerely unintended consequences, as well as the difficulty simply of trying to limit legislation in the context of the breadth of the ex case judgment. So any attempt to limit, in principle, could be challenged. And that's why, in conclusion, I would suggest that trying to address the legitimate concern to ensure that doctors, for example, can act freely in the ethical way we've described and that they currently do, with the protection of guidelines, by the way. They're not in jeopardy if they follow the guidelines. But if greater reassurance is required in that regard, then we're trying to develop new legislation on the basis of X is like trying to build a new house on a condemned site or a problematic site,
Dr. Jackson.